Let's move on from rains to vaccinations. And the Ghana Health Service will from this morning begin administering the second doses of the AstraZeneca vaccines to nearly 250 persons who took their first jabs in March. The inoculations will take place mainly in all the 16 regions of the country where the first jabs were administered. In the Ashanti region, health officials say the exercise will begin on Wednesday, September 1st, with more than 70,000 doses allocated to the region. There's more in this report.
The Ashanti Regional Health Director, Dr. Emmanuel Kojo-Tinkran, says vaccines will be made available in coming days to those who missed the second jab.
We have been given a total of 70,300 doses of AstraZeneca, and we are going to start immunization of all those who have already taken their first dose AstraZeneca and are waiting for their second dose. So if you've taken Johnson & Johnson, or you've taken Sputnik, or you've completed your dose for AstraZeneca, or you've not been vaccinated at all, this one is not for you. We will give it to all health workers and then the general public who has been given their first dose AstraZeneca. The program is starting on the 1st of September, and we will take 5 days to finish.
Dr. Tinkran is entreating those who took the first jab of the AstraZeneca to make themselves available for the second jab to complete their vaccination.
We are encouraging everyone to take part. If you've taken your first dose, it's very, very important you take your second dose and complete. A number of people have been complaining that their second dose have delayed. And this is the time. The government has done so well to get us this vaccine. So let us take advantage and ensure that we are fully vaccinated for AstraZeneca. So when you get your second dose, that means that you've completed the dose for AstraZeneca.
Those who have misplaced their COVID vaccination card will have the opportunity to be vaccinated by providing their names and telephone numbers.
If you've lost your card, all that you need to do is to go to where you vaccinated. You mention your name and your telephone number. They will track it to see whether you've been vaccinated, and then they will give you the second dose. So don't say that you've lost your card, so you won't go for the second dose. Go to the center, mention your name and your number, your phone number. Your data will be captured and a new card will be issued to you.
Reporting for JoyNews, Obidishio Freyamanfo.
What's the vaccination rollout plan, especially in the regions? Well, here is the programs manager in charge of the expanded program on immunization, Dr. Kwame Amponsa-Achiano, with the details.
AstraZeneca, we've done approximately 850,000 persons, of whom a little over half have already received their second dose around somewhere in May. So we now have taken delivery of approximately 250,000 doses of AstraZeneca, and we want to continue with the second doses for those who have been waiting. So we have approximately 400,000 plus persons waiting for the second dose. So the plan is, once you get a vaccine and you look at the population, you definitely have to do a kind of equitable distribution, because the vaccines will not be enough to cover everybody at the same time. So what we've done is we've done some kind of sharing for all regions to benefit based on the data that we have. And so we've distributed our vaccines to all the 16 regions for those who have been waiting for the second dose. So that's the plan, and we're starting this week, today. First of all, you look at those that are most vulnerable. And in our case, it's the health workers. And of course, if you recall, when we first started, we also spoke of the elderly and the people with underlying conditions. So they were first taken care of when we started the vaccination exercise. And for every region, you had some number of persons within this category. So we share the vaccines first for to cover some proportions of health workers and also some proportions of the general population with respect to those who are most vulnerable. And they were the ones who received the vaccines earlier on. You would also recall that when we started the second dose in May, we targeted persons who had received the vaccines from the 1st of March to the 9th of March. So it stands to reason that we just have to continue from the 10th of March. And looking at the data, when we end on the 29th, we would have dished out all the vaccines. And therefore, there'll still be some almost 200,000 people who would have to get the second shot once we get vaccines next week, maximum within the next 2 weeks. We still have some vaccines in the pipeline, AstraZeneca vaccines, and even other vaccines like Moderna, Pfizer, and Johnson & Johnson. But for the purpose of this discussion, I would say that we are expecting 350,000 doses of AstraZeneca to be delivered to us within this week or next week, and then we can restart the second dose and complete it by the middle of September.
And let's do a quick update of our COVID situation. So we have 688 new cases, 7,153 active cases, cumulative confirmed cases of 118,954. Recoveries and discharges still stand at 110,776,000, and we have 1,025 deaths. That has actually gone up by 7 since this morning. So remember to stay safe out there. Wear your mask, wash your hands, and physically distance as much as you can.